Okay, so there were some common features of our research process across the different countries. So number one was obviously the background desk research, where our researchers leading the work in each country read reports, policies, academic articles about health purchasing, and they already filled in the background information from that. And each country also carried out key informant interviews. So that was really the first part of the process. And these interviews were meant to fact check, number one, and number two, also to fill in any gaps, especially regarding any functions that may not have been reported on in policy reports or in public articles, because maybe they were very new or they were only kept as internal knowledge at the time. So these key informant interviews were often with relevant stakeholders in the Ministry of Health of each country or in the National Health Insurance Body, sometimes with academics who had also been involved as consultants on health financing and health purchasing for the MOH and other relevant bodies in the country. Now, after these two steps were completed, each researcher did have some freedom in terms of how do we go back and keep obtaining relevant information and more recent information, because the overall research process took a year or so. So we did want to make sure that what we published at the end was the most recent information available, and also was that there wouldn't be any gaps in our report. So in terms of that, some researchers did have a small team supporting them, but really very small teams, only maybe one or two additional researchers helping them out, maybe with desk research or with administrative support. Beyond that, other researchers just had informal conversations, maybe as a follow-up from the key informant interviews they'd already had, or just informal conversations with relevant stakeholders involved in health purchasing and financing in the country, again to fact check, to maybe get pointed to any recent papers or policies that we may have missed, or just to get some insider information on, for example, what a country's area of focus would be at a particular time. Finally, some of our researchers also conducted focus groups. So they invited stakeholders from academia, from the MOH, from the health purchasing agencies, from the national health insurance bodies, and they discussed the current state of health purchasing in their country, as well as what could be done to improve it and to make it more strategic. And those interactions were also used to fill in any of the gaps as we applied the framework and conducted our research.